Hello friends, welcome to my new video. So today in this video, I'm going to discuss with you all about a very important topic, that is Meibomian gland dysfunction. So let's start. So in the beginning of this presentation, in this slide, you can see that there is some abnormality in the eyelid. Okay. So can you tell me what part of this conjunctiva it is? Yes, you are right. So it is the tarsal conjunctiva. Okay. So here you can see some tortuosity of the Meibomian gland. Why it is happening and how to manage it, that we are going to discuss today. So let's start. So the Meibomian gland, where it is located. So the Meibomian gland, it is a type of sebaceous gland, okay, which is present on the tarsal plate of the eye. So here I wrote that Meibomian gland are the sebaceous gland which are located on the posterior part of the eyelid on the tarsal plate. Okay, so these are located on the tarsal plate, as you can see in this picture. So here Meibomian glands are marked here. Okay, so this is the levator palpebrae superioris muscle. These are the orbicularis oculi, and behind that, in the on the tarsal plate, Meibomian glands are present in the upper and lower eyelid. Okay. Now this is the structure of Meibomian gland, where you can see this nodule-like structure. These are the acini, and this is the magnified view of these nodular structures, where there is, you can see the lipid droplets are getting produced, and these duct-like structures are called ductules. Okay, and the lipid is secreted to the ductules, and it gathered to the common duct. And from this common duct, lipid is going to the ocular surface. So this is the this is more nice picture, where it is mentioned very nicely how this lipid is coming to the ductules and then gathering or collecting to the common duct and ultimately going to the ocular surface. So why? What is the function of this lipid? So these lipids are compound lipid, which is made up of polar, there is the phospholipid and non-polar lipids like cholesterol, wax ester, cholesterol esters, etc. So yes, so this lipid layer is coating the aqueous layer. Why? Because to prevent the evaporation. So our tear film is having three layers: lipid layer, aqueous layer, and mucin layer. Lipid layer, that I discussed, that it is coming from the Meibomian gland. Aqueous layer is coming from the lacrimal gland, and mucin layer is coming from the goblet cells of the conjunctiva. So this lipid layer, as you can see, it is coating the aqueous layer, so that it is preventing the aqueous to evaporate. So the tear film can moist the eye surface properly, with a reduction of evaporation. So what is Meibomian gland dysfunction? From this word, we can easily understand that there is something abnormality in the Meibomian gland. So this is why it is called dysfunction. So Meibomian gland dysfunction is an abnormality of the Meibomian gland of the eyelid, where there is a chronic obstruction of the gland opening, so which lead to blockage of the lipid secretion of the gland. So that is the Meibomian gland dysfunction. So here I said there is some disturbance in the Meibomian gland opening, so that the obstruction is there, so that the lipid is cannot produced or secreted properly, so which ultimately leading to less production of the lipid is there. So so that less amount of lipid is going to the tear film, so that it ultimately leading to more evaporation of the tear film, and ultimately like burning sensation, photophobia, pricking sensation, foreign body sensation, all these symptoms can be appear in the patient if there is any presence of Meibomian gland dysfunction, that we are going to discuss in the later slide. Okay, so what are the factors which can lead to Meibomian gland dysfunction? First of all, age. Due to increasing age, some Meibomian gland start to atrophy, so that it ultimately lead to less production of the lipid from the Meibomian gland, so that there is poor quality of tear film is there, which ultimately leading to some abnormality on the eye, like pricking sensation, burning sensation, photophobia, etc. And redness also there. Hormonal imbalance, use of certain medication can also lead to some hyperkeratinization on the opening of the Meibomian gland, which ultimately leading to less production of the lipid from the Meibomian gland. And environmental factor, because like dry weather, blepharitis, like infection in the eyelid, can also lead to Meibomian gland dysfunction. Giant papillary conjunctivitis due to contact lens wear, where there is papillae formation on the tarsal conjunctiva, so it ultimately leading to blockage or abnormality in the Meibomian gland also. And also the allergic conjunctivitis can also lead to Meibomian gland dysfunction. So in this picture, you can see that the Meibomian glands are very tortuous. So that how you will examine this thing, that I will discuss. Okay. So what will be the symptoms of a person having Meibomian gland dysfunction? As I said you that redness, irritation, burning sensation, photophobia, and contact lens intolerance. Why contact lens intolerance? Because a very important thing in contact lens wear is a healthy tear film. A healthy tear film is necessary in a successful contact lens wearing. So due to that Meibomian gland dysfunction, there is not a healthy tear film is there. More evaporation is there, poor quality of tear film is there. So it ultimately lead to contact lens intolerance, as the patient will not able to tolerate contact lens, and if we continue wearing contact lens, then it leads to corneal edema. Okay, so these are the symptoms that Meibomian gland dysfunction patient can have. So what are the signs? Obstruction of the Meibomian gland orifice, and evert the eyelid, and you can see a prominent gland structure, and after giving a gentle pressure, paste-like matter come out. So in this picture, I gave this picture here. You can see that uh, this thing can best seen with the help of slit lamp. Just examine the patient upper and lower lid by everting it. And you can see that there is prominent Meibomian gland structures can be seen or visualized. Okay. And if you put a gentle pressure on the finger over this area, this type of paste-like matter will come out. So it indicates that the lipid is getting stored in the Meibomian gland, that coming out with the help of that pushing. So it ultimately determines that the patient is having Meibomian gland dysfunction. So you will write it blocked orifice. Okay. So there is many blocked orifice that can be seen. So here you can see this is the normal Meibomian glands with this is the primary stage, where due to the blockage of the opening, the Meibomian glands are now lipid is getting stored there, not able to get out. So in this picture you can see the abnormality in the cell in the Meibomian glands, because here you cannot see the gland, because the cells or sorry glands, the Meibomian glands are went to atrophy. So if this Meibomian gland dysfunction continue for a prolonged period of time, it can lead to atrophy of the Meibomian gland. So if the person is having this type of symptom like burning sensation, redness, photophobia, so he needs a proper treatment at time. And if this Meibomian gland went to atrophy, it cannot be reversible. So proper treatment should be there, or it's very necessary, or else the person will have these dry eye symptoms for whole life. Now here also you can see this area have atrophy, and there is some normality is there. Okay, and this picture I already discussed with you all. Now here you can see normal gland structure like this, and shortened glands and gland loss. Here you can see these are the normal glands, and in between them there is atrophy that cannot be reversible, and significant gland loss is there, where you cannot see the glands there, because the glands are not getting back to its normal or healthy state, because the MGD become long standing in this case, so that there is that this person will have this dry eye symptom for whole life. Okay, so here also you can see there is many blocked orifices are there. So the main thing, that main complication of Meibomian gland dysfunction is dry eye, because there is poor quality of tear film leads to dry eye. Absence of lipid layer, or if there is lipid layer is present, it is of poor quality, so that more evaporation is present. So sometimes Meibomian gland dysfunction is uh, classified as to hyposecretion and hypersecretion. Okay, so in hyposecretion there is less production of lipid, and in hypersecretion also more production of lipid is there, but that lipid is also poor quality. Okay, now for the management. So management can be with the help of lubricants, antibiotics, steroid, antihistamine, and heat provide. So lubricants means the consultant will prescribe some lubrication or lubricating eye drops to avoid the pricking sensation, burning sensation, etc., to moist the eye. Antibiotics, if the Meibomian gland dysfunction is due to any infection, then antibiotic is necessary. And if Meibomian gland dysfunction is due to any skin infection, then a proper dermatologist consultation is necessary to treat these conditions. And if there is any inflammation is there, steroid is advised. If Meibomian gland dysfunction is due to allergy, then antihistamine is advised. And now several procedures are applied to melt that lipid, like a heat provide, means heat and compress. So many instruments are used to heat the eyelid at a temperature of 35 degree or 40 degree to melt that lipid which is getting stored in the Meibomian gland to open it. Another procedure that is applied, there is mechanical management, is like a probing method to open the Meibomian gland opening and then compress it to remove the paste, so that or for the normal functioning of the Meibomian gland. So that's all, friends. Thanks for watching, and please don't forget to like my video and subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Thank you so much.